Hello, today I'm going to be doing a video on oral hygiene on an unconscious or a patient who, incapacitated patient. I will start by doing hand hygiene. I will knock before coming in the room. I will have two identifiers for the patient. Usually name and date of birth is fine. Of course, if they can't answer, then I would have to check the bracelet for that, make sure that I was going to the right patient. Make sure that this patient didn't have any contraindications for this care. I don't know of any, but well, I don't think I remember seeing that on the sheet, but if I thought there might be anything that would make me second guess it, maybe like trauma to the mouth or something, then I would make certain that I could do this care. And then, let's see. Okay, other than that, let's get started. Okay, I'll explain that the patient may not be conscious, but we still explain to the patient what's going on. Sir, I'm going to be doing oral hygiene on you and going to brush your teeth today, okay? Make your mouth feel clean. If I wasn't brushing my teeth, or if I wasn't brushing teeth, I wouldn't say that per se. I will put a chuck on the patient's chest to catch any potential secretions. Put a towel behind the patient's head, the same reasoning. Since the patient may not be conscious or may not have a normal swallow reflex or gag reflex, swallow reflex, I would consider positioning the patient in the recovery position if necessary, even if partially, just so that there's less risk of aspiration. I would gather all of my equipment together, and including a suction. My suction. Here's the suction. Okay. So I would gather my suction. See if I can get this thing to work. Okay, well, this suction device I'm going to need to practice with, but normally I would test it, make sure that the suction is working properly. This one I'll have to research how to use it because I couldn't turn it on. So now I will begin my examination of the patient. Actually, let me go ahead and bring my supplies a little bit closer so you can see me, and so I don't have to keep on traveling over there like I was. I have a tongue depressor here. I'm going to use that to check for a gag reflex. Make sure see if the patient has a gag reflex or not. If the patient does have a gag reflex, they're at even a higher risk of aspiration. And if they do have a gag reflex, you're going to want to know about that. If need be, I can insert an OPA. I would make a good examination of the mouth. Make sure that I look all over the oropharynx, under the tongue, at the gum line, for any lesions, any sores, any gingivitis, anything, thrush, any infections of any sort. I note that if there's a scent coming off of it, if the patient has halitosis, I'll note that. Could consider using a bite stick if the patient could potentially bite and clamp onto some of my equipment. Might want to use a bite stick. Of course, the OPA would work for that as well. keep the oral airway open. If the patient is, if the patient doesn't have a gag reflex, then I would take note of that and make certain to have the suctionate ready at all times, make sure the patient doesn't aspirate anything. I would auscultate the patient's lungs and check their respirations before I began. You know, I can examine their mouth first, but before I added anything to their mouth, I want to check the patient's lungs, make sure they don't have any signs of aspiration or aspiration pneumonia or anything like that. Make sure they're not aspirating. And if I would check their teeth, see if they have teeth, or if they have a partial bridge, or if they have dentures. If they have teeth, then I would brush their teeth with toothpaste. I would brush their teeth. I would put toothpaste on the toothbrush, and I brush the teeth surface or the chewing surface first. I would also do the back, chewing surface in the back, and then I would go to the front surface, and I brush them just like you brush your own at home, not too hard, probably for about 30 seconds per 4 quadrants. If the patient was conscious, I might ask them if they'd like to be flossed. If the patient didn't have teeth, then I'd pour some of this mouthwash in there, and I'd use some of these sticks. I don't remember what these guys are called, but then some of them come pre-moistened, some of them you get mouthwash. Then you'd use that to clean all the different surfaces of their mouths, making sure that they're not gagging. I just brush the teeth. I'd go ahead and suction right now, actually. Don't want to suction for too long. You could start pulling air out of their lungs, so no longer than probably 15 seconds. It shouldn't be too much of a concern, but go ahead and clean all the different surfaces. Make sure to get under their tongue, make sure to get their tongue, make sure to get their gum line, make sure to get every surface in their mouth, and you can use a bite stick or an OPA like if you want to. And after you've done that, go ahead and suction it again. And having done the procedure, I've been monitoring their breathing, their respirations this whole time, making sure that their respirations are fine. If I notice them cough at all, if I notice if I just notice any problems, like if I notice them aspirate, if I see any signs that they're aspirating, then I'll stop, and at this point I'll auscultate their lung sounds again and make certain that I'm not hearing any signs of aspiration right now. I suction their mouth. I'll ask them how their mouth feels, if it feels clean. If they had dentures, I guess it would depend. I might replace them. I may not. And other than that, I would clean any of my equipment. If I did, I'd change the gloves so that I'm not contaminating the equipment. With this, if it's all disposable, then I'll dispose of the equipment. I'll do hand hygiene, and I'll document the procedure, document any findings. I got to remember to do this, but at the beginning I would have raised the bed and lowered the bar, the side rail, so that I'd have better access to the patient. And now that I'm finished, I will raise the side bar so that I know that the patient is, isn't going to fall out of the bed, but also I will make certain that they're in reach of the call light. And I ask them how they feel. I document it, and I can actually add a little bit of room to their lips. Of course, I didn't mention this, but obviously true. I would remove this, remove the towel, but if I did have an OPA, I would also remove that, and I'd clean up anything I left here. If I did use a suction device, I'd remove that, remove the canister, all that disposable equipment. Anything that we clean, I would clean with a separate set of gloves. I would let the patient, make sure the patient's good and warm, or let the patient remain exposed, and that should be good. The patient had dentures that I had to remove or had removed, and yeah, it wouldn't matter what our protocols were, whether I'd replace them or not. An unconscious patient, I guess I'm not sure which one you'd do.